Hi, my name is Dr. Howard Austrager. I want to welcome you to my Thyroid Symptom Relief website. I'm a local chiropractor who's been in clinical practice for over 12 years, and I've been practicing in Framingham for the last 10 years. I'm not your run-of-the-mill chiropractor. I've had additional graduate level training in neurology and nutrition. I'm currently enrolled in a Diplomate of Chiropractic Neurology program, a Master's of Neuroscience program with the Carrick Institute. I've currently taken over 200 hours of graduate level neurology. I've also been attending lectures on nutrition, biomedical nutrition, through the University of Bridgeport with Dr. Datis Karazian. He's one of the foremost experts on thyroid disorders and author of the book, Why Do I Still Have Thyroid Symptoms? My Lab Tests Are Normal. Now, based on my extensive knowledge of neurology and functional nutrition, I use a different approach in diagnosing and treating thyroid disorders. After studying more about thyroid disorders, I realized how poorly managed thyroid conditions are. According to, I think, the National Women's Health Center, 1 in 8 women will experience a thyroid disorder during their lifetime, and it affects over 20 million Americans. So there's a lot of people with thyroid problems. Now, what makes me different from every other doctor you've seen? Well, I treat patients metabolically and neurologically. You're watching this video because you or someone you love is suffering with the thyroid problem. Now, I'm going to get right in there. First, I'm going to talk about how the thyroid works. Your thyroid gland basically runs your metabolism. It's literally the gas pedal of your body. Every cell in your body has thyroid receptors. Your thyroid gland supports your bone metabolism, your immune system, brain and nervous system, your gut, your endocrine system, insulin and glucose metabolism, even healthy cholesterol levels. Now, in healthy people, the thyroid gland makes just the right amounts of 2 hormones, T3 and T4. And they're kind of named after how much molecules of iodine they have. T3 has 3 molecules, T4 has 4. But the thing about these 2 active hormones that most of it is converted into T3. So we get T4 and T3, and most of it's converted into the T3, which is the most active part of the thyroid. And it's converted into this T3 in different areas of the body, the liver, the gut, and different things. Now, many times people's problem isn't a problem with just their thyroid, it's a problem with converting this T4 to T3, and this could lead to many different symptoms. Now, one of the controversial medications, something that's called Synthroid, most of you have probably heard of it, that it's really only the active form of T4. So if your body has a problem, converting the T4 to T3, you're going to get little relief from the thyroid medication. Right? Now, iodine is very important to your body. Deficiency has been linked to ovarian cancer and breast cancer. But listen, don't go right out and get all the iodine that you can, because unless your condition is really diagnosed thoroughly, iodine has been equated to actually throwing gas on a fire. Because if it's not the specific causes of iodine deficiency, it'll actually make you feel worse. So that's what makes it even that much more important to get your thyroid gland, your thyroid disorder, evaluated correctly. Now, really the only way to be diagnosed correctly is to be thoroughly evaluated. Now I'm going to really go into that, in a little bit more detail. Now, to start off, there are 3 main types of thyroid problems. There's hypothyroidism, hyperthyroidism, or Graves' disease, and Hashimoto's. Now, the first type, hypothyroidism, is basically, sluggish, slow-working thyroid. You may feel tired, fatigued, your hair may be falling out, your skin may be dry, mentally you may not be as sharp. With hyperthyroidism, you might experience maybe heart palpitations, or a racing heartbeat, or night sweats, insomnia in general. And Hashimoto's thyroiditis is actually a condition it's an autoimmune problem that for some reason your body is attacking itself. And the only way you can diagnose that is by checking the specific thyroid antibodies. Now, people with Hashimoto's disease usually have a mixture of both the hypo and hyper symptoms. So any and all the symptoms I mentioned previously, you may have one or more of those. So, as you can see, there's a lot of symptoms that kind of relate to your thyroid problem, and I'm here to tell you that no stone is left unturned to determine the exact cause of your condition. Now, a disturbing trend I've kind of seen among my thyroid patients is that everyone's treated the same. They look at their TSH, they adjust their medications. Now, the truth is that no 2 people are alike. From studying, advanced neurology and nutrition, people respond differently to different problems. And I can tell you that by treating your thyroid naturally, you might not need to take your medication at all. Now, don't get me wrong, I'm not here to tell you to stop taking your current medication. Our office would never do that. We actually work with your medical doctor to get you feeling better and as quickly as possible. Now, how do I successfully treat these disorders? By using specific metabolic and neurological testing and treatments. First off, I run a complete thyroid panel, not just your TSH and T4. There are up to 10 additional thyroid tests that I can run. Free T3, total T4, T3 uptake, as well as your antibodies. I do a complete metabolic panel, lipid panel, complete blood chemistry with something called auto-differential, which kind of breaks down your immune system in more detail. We check your blood to see if you're suffering from an autoimmune disease, like Hashimoto's, where your body is attacking itself, which means it's not really a thyroid problem, it's an autoimmune problem. Now, there are two specific blood panels that we order. There's actually two parts to your immune system, the Th1 and Th2. Th1 are the T cells. These are like the soldiers that go and fight different things and clean up afterwards. And we measure them by looking at two blood markers called interleukin-2 and TNF-alpha. Then there's Th2, which is made up of B cells, which are kind of like the generals, they're antibodies, and they tell what the T cells to kill. And we measure those by looking at a blood work called interleukin-4 and interleukin-10. Now, if either of these numbers are dominated in one or the other, you could be either Th1 or Th2 dominant, which means there's an imbalance in your immune system. We also check something else called the CD4-CD8 ratio, which is kind of like the ratio of these T to B cells. And it tells us, looking at a specific number, whether your problem is caused by an active antigen or dysregulation. Now, an active antigen is something like bacteria, yeast, fungus, food sensitivity. Dysregulation can mean a problem with your adrenal glands, a type of anemia, blood sugar control. Now, the thing about these autoimmune tests is that if your problem is autoimmune, it trumps everything else. If your thyroid condition is caused by an autoimmune condition, you will not get better unless you check for these thyroid markers. What else we also check for? We check for food sensitivity. We check to see if you have a sensitivity to gluten, which is the protein found in wheat, oats, rye. We check sensitivity for dairy, for milk, for eggs, for yeast, for soy, and a lot of different things. If you're suffering with a chronic problem, or you have stomach problems, or problems going to the bathroom, constipation, or diarrhea, you may have sensitivity to one of these different foods. We check for your anemia levels. Be surprised how many people are B12 and iron deficiency anemia. I see B12 anemia a lot in my thyroid patients. We test your adrenal glands using something called an adrenal stress index, which measures the amount of cortisol, or your stress hormone, that goes throughout your body. Now, if you've been under a lot of stress, have trouble sleeping, problems with blood sugar control, then this adrenal stress index is a must. And it's actually almost important to look at your adrenal glands as is your thyroid glands when we're evaluating your problem. We also check your hormone panels. Has your doctor ever checked your hormone panels? Specifically an expanded hormone panel. And if you're postmenopausal, have you been explained the risk factors for uterine or breast cancer? And we use these hormone levels to let us know how you're doing. If you're a male, have you been diagnosed with low testosterone or andropause? Have you had your hormone levels checked? This could be causing a problem with your thyroid condition. Right? We also check something called leaky gut syndrome. If your gut, the linings of your stomach, intestines are not working the way that they should, if this lining is too big and letting in too many big particles, this will affect your body and cause inflammation in your body, so we check for that. And if all these larger molecules get in there and they affect your body, they're going to cause inflammation and cause problems and mess up the balances. Now, many times we will take your blood work and use our functional blood chemistry analysis software database, which kind of helps determine what's going on with your specific condition. The thing about thyroid patients is that no two people are alike. Like I explained earlier, by using the same treatment on everybody, it just doesn't work. Each person needs to get their individual blood work and tests done so we can make specific recommendations on what you need. Now, what I found is that people who take different supplements that aren't based off specific blood work, chances are they don't work. So that's a big part about our program. We look on what's going on with you, not the diagnosis, not the disorder, only what's going on with you. Now, I've talked about, what makes this difference in all the metabolic testing and different things that I do, but there's also a lot of neurological testing and treatment that we do, and it's an integral part of your treatment. Your brain and your nervous system obviously control everything in your body, and they need two things to survive. They need fuel and they need activation. Fuel comes in the form of glucose from the food that you eat, and oxygen. And oxygen is very important to the brain. That's why it's very standard in my office when you come in for an evaluation, actually check your oxygen levels. And many times my thyroid patients need supplemental oxygen therapy to get their brain working better and helping their nervous system and thyroid function more effectively. Now, I must thoroughly, and test you and treat you neurologically. Now, when I test you, I do a lot of different tests to evaluate your cerebellum, your frontal brain, all different lobes of the brain. And then we use different therapies to stimulate parts of the brain that we may find deficient. We may use gentle chiropractic adjustments, vibration therapy, auditory stimulation. I'll have you go on oxygen while you're riding an upper body ergometer, which actually increases your brain firing and actually activates neuron cells, which can help your body. Now, things I have to ask you and questions that you may not know is, has your doctor run a complete thyroid panel on you, not just T4 and TSH? Have you been tested for food sensitivities by the gluten, the dairy, the soy, all these different things that can cause extra inflammation in your body? Have you had a complete neurological evaluation to see if it's a brain imbalance that's actually causing the problem? Now, if you answer no to any one of these questions, then your thyroid condition may not be being managed properly. All these tests need to be run in order to see what the true cause of your thyroid problem is. Now, you can see that it's a pretty complete program that we have here, treating you neurologically and metabolically. And you need to ask yourself some questions. How has your thyroid problem really affected your life, your finances, and family? What does this cost you in time, money, happiness, and sleep? And where do you see yourself in the next 1 to 5 years if you don't get your thyroid problem taken care of? Now, because you're visiting my website and watching the video, what I am offering you is 2 free visits. Now, the first visit is a chance for you to come on in and have me do a complete consultation and case review, meaning all the previous lab work and treatments you've had. I want you to bring in all that information so I can see what you've been doing and what's going on. I'll also do a neurological screening. What you'll do is then you'll come back on your second visit, and I'll go over what I found from reviewing your case, reviewing your history and your consultation, blood work that you brought in, and I will lay out for you what I think it's going to take to get you better. All the testing, all the treatments. Now, everyone's plan is individual, so that's why I take this time to go over your specific type of information. And at that time, we come in the second visit, then we'll talk about really what I'm going to recommend for you, how long it's going to take, and what it's going to cost. And whether or not I'm even going to accept you as a patient. Now, the thing is in my office, I don't accept everybody that comes in. It's not easy. The programs I'm talking about aren't as easy as, this is the problem, come take a pill. Really, it's finding out what's going on with you. And many times I need to make specific dietary or certain changes that are going on with you. Many people with a thyroid problem, they need to go off gluten. And if I know that you say, I'm not going to do it, I'm not going to be able to go off gluten, it's too hard, I like it too much, I'm not going to quit smoking, or different things like that, then you know what? This is not a good fit for you. When you're ready to take do what it takes to get committed to come on in, then I'll be able to accept you as a patient. Also, something to consider is a lot of these tests I mentioned are expensive, and many of them are not covered by your standard insurance plans. So there will be some out-of-pocket costs for you to complete my treatment program. Now, what I want are people who are willing to take responsibility for their health, to do what it takes to get better, and to follow my recommendations. And those that follow my recommendations typically do get better, and I've had a lot of success, myself as well as many doctors across the country who are doing this very similar program. Now, to set up your free consultation, you can call 508-620-1585, or you can email me at draustrager@gmail.com. I hope I gave you a lot of information and I didn't talk too fast, and I look forward to meeting you soon.